We hope you're all staying warm and dry and safe.
Shelley, we can begin.
Let's
This is
go.
great. It's 101. Welcome, everyone. It's so great to see you. Shelley and I are excited about today's episode. Today, our conversation is about justice and advocacy for disability rights. Please post your questions and comments in the chat box. We'll have time for those after our conversations. We are recording today, and you'll get the link as soon as the episode is posted. Everyone's welcome is captioned. Just click on the closed caption button at the bottom of your Zoom screen, and you can click on subtitles. You can also find our past episodes at jkidaccess.org/everyone's welcome. Everyone's Welcome is a partnership between my organization and Jewish Learning Venture and Shelley's organization, Inclusion Innovations. We're both published authors, speakers, and since last May, webinar co-hosts. We are moms of sons with disabilities whose careers in the field of Jewish and interfaith disability and mental health inclusion were born from our own life experiences. We created Everyone's Welcome to bring people together about many of the diverse approaches to belonging and inclusion.
Thanks, Gabby. And can we put up the slide, the slide for Community for All? I just want to hold that up there. Oh, thank you.
I'm going to get it, Kelly. Hang on.
No worries. Well, February is Jewish Disability Awareness, Acceptance, and Inclusion Month, also known as JDAME. Many of our colleagues from diverse faith communities are participating in their own communities along the same vein. You may be interested in Community for All, which is a virtual interfaith conference being held this Friday. In addition to a wonderful lineup of presenters on Friday, Community for All also has over 30 pre-registered presentations from an impressive lineup of faith community inclusion speakers. I urge you to visit the Eventbrite page, which you can see on your screen, or you can Google Community for All. And you can learn more and register. Gabby and I recorded a session on Bar and Bat Mitzvah celebrations with our friend Howard Blass, and I've recorded a presentation called Belonging in Action. And our friend Aaron Kaufman, who many of you have met on this show, if you haven't met him in other venues, he's going to be on a live panel on Friday discussing advocacy. So that'll be Friday afternoon. When Gabby and I discussed this particular episode, I turned to my colleagues at the Interfaith Disability Advocacy Coalition, or IDAC. IDAC mobilizes the religious community to take action on disability policy with Congress, the President, and the administration, and society at large. IDAC is a diverse, nonpartisan coalition of national religious and religiously affiliated organizations whose core spiritual values affirm the rights and dignity of people with disabilities. And AAPD serves as the convener to bring together the diverse voices of the disability and religious communities. What I'd like to do is introduce our speakers now, our guests who are here for conversation. Lindsey Warburton is a policy analyst at the Episcopal Church Office of Government Relations based in Washington, D.C. In addition to her work on criminal justice and payday lending, Lindsay leads her office's work on disability policy and serves as co-chair of IDAC. Lindsay received a BA in Global Studies with a focus on international politics in Latin America and a BA in Hispanic Literatures and Cultures from the University of North Carolina, Chapel Hill. Reverend Dr. Sarah Lund served as regional minister in the Florida Conference of the United Church of Christ and as a vice president for Christian Theological Seminary in Indianapolis. Reverend Dr. Lund received the Dell Award for Mental Health Education at the 30th General Synod of the UCC. She is the author of 2 acclaimed books on mental health. And Sarah is the Minister for Disabilities and Mental Health Justice on the national staff of the UCC. And she's also Senior Pastor of First Congregational UCC of Indianapolis. Charles Clark joins us today. Charles is a core family member at L'Arche, Greater Washington, D.C. And a core family member is the term used for adults with intellectual disabilities at L'Arche GWDC. Charles is active with the L'Arche GWDC board and with L'Arche USA. He's a passionate advocate in local politics, and he volunteers with the ARC of Northern Virginia on their communications committee and through their alliance work. Charles is a musician and a singer, including an avid player of the harmonica and other instruments, and he has lived at L'Arche GWDC for 11 years. Welcome, everyone. Thanks for being here today.
And Lindsay, we're going to start our conversation with you. Can you tell us what drew you to the work that you do that's at the intersection of faith and the Episcopal Church Office of Government Relations?
Absolutely. Thank you both for having me here. It's great to be on. I grew up in the Episcopal Church. Faith was always something that played a role in my life. I was in the campus ministry when I went to college, and I was a summer camp counselor for a few summers, helping children. And part of that was service to others. And that was a core value that was instilled in me at a young age. But when I saw this opportunity open up at this office, I saw this really interesting pathway, something I had not considered before, which is the intersection of faith and politics, and more specifically, faith and policy. And I saw a unique opportunity to learn, and ultimately I fell in love with it. So I come from North Carolina, but as you could hear from my majors, I have a passion for international issues. But what I really have a passion for is helping others and learning more about the people in our country and what they need, and how I can raise the faith voice into that space as we make policy. So it's really as simple as that.
Thank you, Lindsay. Can you tell us from your work, what do you think are the pressing policy issues that impact the lives of people with disabilities?
Absolutely. So as we mentioned at the beginning, I'm as part of my work leading disability policy, I'm the co-chair of IDAC, the Interfaith Disability Advocacy Coalition. And so part of my role is to help decide kind of what we're looking at. And I see a few avenues in this upcoming Congress. And I'll name a few of them. There's potential for some movement in the finance area. So for example, I was at a conference last night, the Jewish Disability Advocacy Month, which is different than JDAM. That was put on by the Jewish Federations of North America. They spoke a lot about the Able Age Adjustment Act. So allowing people with disabilities to save their money in a way while also receiving federal benefits that they can put towards disability related expenses. And so it's a really technical way of saying, allowing people with disabilities in a broader sense to save money. We're looking at health, especially long-term support and services. So people in group homes or nursing homes, and making that mandatory under Medicaid, providing funding for that, which is especially relevant during COVID. And so I think the overarching, while I'm talking about policy in the long-term sense, our first priority moving ahead is going to be addressing COVID and getting funding for Medicaid, long-term supports and services, the SNAP program, so previously known as the food stamps program, which has a high percentage of people with disabilities on it. So COVID relief is tied into all of this. And finally, I'll say that the third thing that we want to focus on as a coalition, and kind of what we see in every Congress and in this Congress, is is the rights of the disability community, civil rights. So protecting and strengthening the Americans with Disability Act, one of the biggest pieces of legislation, civil rights legislation, passed in 1990. And then also kind of tied into that is kind of rights as citizens to be free from violence and discrimination, either by the police or the criminal justice system or society at large. So that's a very, very broad overview. And there's a lot of technical things in there, but those are kind of the basic ideas. I'll say finance, health, long-term supports and services, and civil rights.
So compelling. One of the things we did, Lindsay, with IDAC was have a meeting with Josh Dixon, who was on the transition team for the Biden administration, is now involved in I believe he's the faith community liaison for the administration. So that's, it just really goes to show that there's a significant voice in the faith community world as advocacy evolves.
And so what I already saw it in the chat, and I know, Shelley, you asked me, if you'd like to learn more about IDAC, we're in the process of updating our website and our social media. But after, perhaps when we get towards the end, or I don't want to interrupt people speaking, but I will include information in the chat about how you can reach our website and our social media. And we hope to be updating that with some of our initiatives, our statements, our sign-on letters. There's lots of avenues for advocacy. And so we'd love to share that information with you. So I will put that in the chat later on.
Thank you, Lindsay. We're going to turn to Sarah now. And Sarah, same question. What drew you to the work that you do as the Minister for Disabilities and Mental Health Justice on the national staff of the United Church of Christ?
Thank you so much. The United Church of Christ was part of this movement for disabilities justice all throughout the 70s and 80s. In 1990, the Reverend Dr. Harold Wilkie was there on the lawn of the White House when the Americans with Disabilities Act was signed into law. And so the faith community I'm part of, the United Church of Christ, a Protestant progressive denomination of about 1 million members, we have seen disability and mental health justice as part of God's broader call to do justice. It's also part of what we believe brings wholeness and health. And that's where I personally got involved. I grew up in the 70s and 80s in Southern California. My family went to church, and it was the pastor of our Lutheran church where my mom first broke the silence about the mental illness in our family. My father was a successful veterinarian and community leader who lived with an undiagnosed, untreated mental health condition. His bipolar disorder was getting more serious and causing a lot of disruption in our home life and at his work life. And so my mom turned to her faith leader. That's what we see in a lot of our communities, is our faith communities become the place where everyday people turn to for help. And so I'm the daughter of someone who had a very serious chronic mental health condition, which led to overall health deterioration. And so he also lived with physical disabilities and mental health disabilities. And in our family, the bipolar disorder is hereditary. And so I have siblings with bipolar disorder, and we're seeing mental health conditions in other generations in my family. I am in recovery from post-traumatic stress disorder. So I come to this from lived experiences, and it's been so important to me to have a faith community who affirms that we are more than our disability, we are more than our mental health condition, and a faith community that believes in equality and care for everyone. And so I am just overjoyed that in my personal journey, I'm part of a broader community of faith that can organize people and really bring about the change that we want to see in the world. We can equip people and educate people, and our votes really make a difference. And so that's why I'm really excited to be part of this movement with you all. Thanks for having me on the program today.
We're thrilled to have you on the program, and thank you for sharing also some of your personal story. I think that we need to hear, people need to feel it's a safe space to be able to share the stories, and that's really overcoming the stigma too. So, especially in terms of people with lived experience with a mental health condition and also disability, what do you see, Sarah, as some of the pressing policy issues that impact their lives?
Thank you so much. I think you said it, the stigma. We can make mental health care affordable. We can make mental health care accessible. Yet we know from some of the research that it takes folks an average of 7 years from the onset of symptoms to actually getting help. And there's a lot of self-stigma. This idea of shame, of, somehow it's a moral weakness or character flaw. And that's why I think faith communities can really help affirm that, it's part of our biological makeup, our physical health, our brain health, and that there's no shame and there's no sense of being punished by God or a sense of sin or brokenness. And so it's interesting how powerful that stigma and shame really is. And so telling the stories like this and looking through the lens of our sacred scriptures to affirm the value and worth of everyone is so important. So the stigma part is something we can all work on, just one conversation at a time. But then I would say that one of the biggest policy issues is expanding Medicaid. We want to expand so more people have more services. And a lot of folks are experiencing success with telehealth. And that's been a temporary opportunity because of the pandemic, because we can't be in person safely. So there's hope that we will continue to offer telehealth and audio only. We know that transportation was a barrier to getting services. So telehealth really opens up that. And the other thing I'd say as a policy issue, you've seen cities and places around the country that are claiming racism as a health emergency. And I would take it one step further in saying that racism is a mental health crisis. And so to look at people of color, Black, Brown, Indigenous people of color, and see how we can help to provide resources and opportunities for services in communities that really are being impacted at a much higher levels in terms of rates of depression and anxiety.
Thank you so much, Sarah. We're going to turn to Charles now. And just for those who put questions in the chat, after Charles shares, we're going to go to your questions. Charles, what drew you to the work that you do as an advocate in local politics?
My involvement in politics is to see we vote for people who's going to help the DD waivers, and also help other people, especially Joe Biden's going to get stimulus checks out for $1,400, and that's going to be a big help. And I'm unemployed right now, looking for a job, full-time job, and also it's good to get more DD waivers up to maybe $50 million, more to help other people.
Do you want to explain what a DD waiver is?
Thank you.
A DD waiver it allows you to live in a place like Ross, and if you don't have a DD waiver, you can't get in. You have to have a DD waiver. See, I'm also representative of the USA.
Charles, that's so important. So you mentioned employment, you're looking for a job, and you mentioned waivers. Are there any other issues that you think are affecting the lives of people with disabilities?
Vaccines and accessibility. Accessibility is have ramps for buildings, so people confined to wheelchairs have access.
What about vaccines?
And vaccines. I got my vaccine, got my booster shot, got both shots. And a lot of people across the country is getting shots are going way up, and deaths are going down, and hospitalizations going down. That's what we want. See, Dr. Fauci on Biden's task force said maybe by early summer, between April and May, get back to normal somewhat until we get fully everybody vaccinated back to normal, where they can be with people, and have picnics and stuff like that, and people come to dinner and everything, and that's good. And also Medicaid waivers for people who need that, so make up about $55 million for Medicaid too, and all our state legislatures. I know one of our state legislatures called Alvin Lopez. Alfonso Lopez is my state senator. And I often write to him, and he writes back, and he's been to our house. I'm going to invite him to come back sometime, and things like that. And yeah, and
We're so happy that you were able to get the vaccine, and you said the most important thing, that everyone who has a disability has access to it.
Right.
Yeah. Shelley, I'll turn it back to you, and then we'll get to our other questions and comments.
Right. And Charles, I'm so glad that you're advocating and working on behalf of people having access to that $55 million pot of money for the Medicaid waiver, because without that waiver, a lot of people are not able to live full lives, self-determined lives in community, and it's just so important. So thank you. I want to move on to one last question for all of you, and then we have some great questions in the chat as well. And Lindsay, we'll start with you. How can faith communities respond to the call for advocacy and justice with and for people with disabilities, mental health conditions, and allies?
Right. So, obviously my bread and butter is advocacy, right? And so something that I'll recommend is do your research, right? If you are interested, the first step is identifying the issue, whether it's food insecurity or housing or transportation, and then why is this happening and what do you need? And so it's doing your research and finding who your representative is at a local. Some of these accessibility issues are quite local, and getting ramps. Find out who your local officials are and who do you need to get snow shoveled off. And it's doing your research and figuring out where you can speak to them and who you need to bring to the table. And so as with our coalition, you can do your own informal coalition at a local level. Are there other churches or synagogues that are impacted by this issue, or people in your church communities? Of course, I only work on a federal level, and so that can have broad implications for accessibility and rights on a bigger level. So, if you're feeling particularly mobilized, do the same research on there. What have they said on disabilities? If they haven't said anything on disabilities, why? You as a constituent, as a person living in the community, have the right to ask that. And of course, and I think doing your research on advocacy, but also do your research on if you are an ally or a family member of a person with a disability, it goes beyond just speaking for that person. How can you mobilize people in the community who are dealing with issues, or or dealing with, not getting access to the vaccine, and talking to them as well. And if you have the power and the privilege to communicate that, that's great. But I would say do your research is kind of and join with others are my suggestions for how we can engage. The faith community is an important voice and a unique voice. And we can bring both a moral and a pragmatic approach to tackling these issues. So that's my advice.
That's great advice. You attended a training last night through the Jewish Federations of North America, and traditionally before COVID-19, groups of people representing Jewish communities from across the United States met on one day on Capitol Hill to learn about some of the policy issues, the ABLE Act, Age Adjustment Act, and several of the other acts, and had really had a voice in advocacy. And I keep thinking faith communities just come together on a federal level, a state level, and a local level, because you can really make a difference. So I want to thank you for that, Lindsay. And let's ask Sarah, same question. How can faith communities respond to the call for advocacy and justice with and for people with disabilities, mental health conditions, and allies?
Thank you so much, Charles and Lindsay, Shelley, and Gabby, for this really important conversation. I'd like to kind of bring the focus back to our own kind of circles where we find ourselves, our local community, because so often we tend to think of what can we do for those people over there, and to balance that with what about the people in our own neighborhoods, our literal neighbors next door, and in our faith community, the people living in the neighborhoods, the kids going to the local school. And so that's why in the United Church, we have curriculums that educate our faith communities on how to be wise, welcoming, inclusive, supportive, and engaged for mental health. It's a training, and the whole congregation can vote to be a wise church. And then what that does is it invites the local community to look and see what are the issues that are meaningful to them, to their families, and to their communities. And that way we can take action. You'll find that some cities and some counties do have funding to address the mental health crisis. And so I'd be curious for each of you in the city you live in, what your county council is doing, what the mayor's office is doing to address the mental health needs of people in the workplace, of people in the schools. We also have a training program called Accessible to All. And this, again, helps faith communities look at accessibility. And like I said about one of the biggest areas to grow with accessibility is our attitudes, the attitudes we have about people living with mental health challenges and disabilities. And so one example of that is to look to see what your local school district is doing and what kind of services do the kids in your public school have in terms of mental health support and accessibility for education. Are they getting their supports that they need, especially during the pandemic? And really listen to the stories of what's happening in your community. And I think we can make a really big difference acting locally.
Thank you, Sarah. I'm going to check out those programs. And if you put in the chat how people can learn more, that would be great. That would be great. Thank you. And Charles, how can faith communities respond to the call for advocacy and justice with and for people with disabilities and mental health conditions and allies?
I'm Roman Catholic, and my ancestors came from Rome, Italy, and I go to Queen of Peace. And we have two people in wheelchairs, and we have ramps make it more accessible. We remodel the whole church, and they can come to church in wheelchairs, one that's confined to wheelchairs. And I'm glad to see that. All churches follow our lead and put ramps in and elevators. If a church is big, have several floors, have elevators put in, make more accessible. And I was going to be have confirmation in my church before the COVID happened. When COVID happened, I have to postpone it, my first communion, and I will have that when all the coronavirus is over with. And everybody is welcomed in our faith community. Come to Queen of Peace on 19th Street, South Arlington, where I live. Thank you.
Thank you, Charles. And I know, like you said, with the vaccines, that day is coming when you'll get to have that service. So we do have some questions from the chat, which is awesome. So I'm going to go to a question that Denise asked earlier. It's for Reverend Sarah. Do you feel that clergy are being universally trained in mental health?
I know for a fact that we are not. I have been ordained since 2002, and one of the areas of advocacy we're working on is with the national level that sets the standards for authorizing ministers, and we are integrating awareness about mental health and disabilities into that training. And so it is an area that each one of us in our faith communities can advocate for. Specifically around mental health, what we are encouraging is that folks get trained in mental health first aid. Mental health first aid is a nonprofit. They have online virtual training now. So one quick example is that when my mom spoke to the pastor about what was happening in our family, very wisely, the pastor said, well, I think you all could benefit from family counseling. So my mom found a Christian counselor. And the Christian counselor asked us as children, I was about 7 years old, if he thought that we should leave our father as a way to address the challenges. And so that was a little scary as a child to be asked that kind of question and be expected to make that decision. But all that to say, it was great that the pastor knew to refer my mom to counselor. What maybe the pastor didn't know is what kind of counselor my mom would find. And so a really important thing for all of our faith communities is to vet the mental health professionals in your community so that when someone does need help, your referral is a good one and someone who is trained to really work with families.
Thank you, Sarah. I also want to note that Shelley put the website for the mental health first aid in the chat box, so everyone has access to this. And Lindsay, I'm wondering if you can take this next question. Heidi wrote about the need for issues around appropriate housing and long-term living supports for people with high need autism and other high need disabilities. What's being done to address that?
Definitely, and that's a great question. The question on housing specifically, sometimes what we don't realize is that a lot of the initiatives that other advocates are working on have a high impact on people with disability. For example, I mentioned the SNAP program, the Supplemental Nutrition Assistance Program, so the food stamps, right? We have lots of advocates in the community pushing for that. And it also happens to help people with disabilities. Housing is similar. And so the advocacy for Section 8 housing vouchers and other affordable housing grant programs is something that the disability community is also looking toward, because oftentimes with the high unemployment rate of people with disabilities, income is a large factor. And so affordable housing is one aspect and accessible housing is another. And when you start going into long-term supports and services, so what do we mean by this? We mean somebody coming into your house and helping you with transportation or bathing or eating, your daily functions. That's where we start looking into the Medicaid. So Medicaid is the primary provider for long-term supports and services. And right now it is not a mandatory service under Medicaid. And so what we have is tens of thousands, if not hundreds of thousands of people on waiting lists for this. And so what is needed is advocacy, not just for funding, but to make this a mandatory service, because people with disabilities, regardless of their disability, whether it's a physical disability, an intellectual disability, have the right to live in the most integrated setting in their community. And so they're all pieces of the same puzzle. And so I would say right now what's being done is the IDAC, we did some advocacy around the Money Follows the Person program. It's a program that transitions people from people with mental illness, people with disabilities, and older adults out of institutions and into the community. That's a specific Medicaid program, but there are also other avenues as well. And that those programs supporting home and community-based services and supporting the wages and the conditions of the people who are going into these communities. We call them direct support professionals. That's a huge issue. There's a high turnover rate and they're very low paid as well, which contributes to the hard working hours and to low pay as well. So there's many avenues, whether you go for Medicaid and home and community-based funding, or you look at funding and raising the wage or raising rights for the direct service professionals. So that's a little bit about the landscape for long-term supports and services.
Lindsay, thank you. And I think Shelley and I, constantly when we do these shows, we have our light bulbs like, and then our next show and our next show. And as you know, my heart is with you and what an important issue this is. So we'll get another episode truly focused on this. But we want to thank Charles. You put in some great links in the chat about more about that awesome advocacy you're doing. And we want to thank you, Lindsay, and we want to thank you, Reverend Sarah, for illuminating the role of faith communities in advocacy and justice. We wish you all continued success in this important and necessary work. It's been so great having a conversation with you. And Shelley, I'll get our slides up so everyone can have a visual.
You've raised so many issues today. I want to thank you for your work and your passion, and just blessings to keep on keeping on and to bring more of us along on that journey of advocacy, because it really matters. It really makes a difference. Well, we're very excited to let you know about our next episode of Everyone's Welcome, and hope you'll join us on Tuesday, March 9th, not Tuesday, February 23rd. That would be today. And we'll send a notice out.
New info very soon.
So our next guest is Matthew Shapiro. Matthew is a disability consultant, lobbyist, speaker, and he's also the founder of Six Wheels Consulting. As a person with a disability, Matthew has spent most of his life motivated to teach those he has met how to better understand the disability community. Matthew he's accomplished so much he's young. So he's done so much already, and I know you'll enjoy hearing from him as an innovator, an entrepreneur, and as a change leader. And before we go, Gabby and I invite you to check out our books on your favorite online store. Both of our books are available in paperback and ebook formats. And then we have a big announcement to make. Next slide, please.
Oh, yeah. Thank you, Shelley.
There we are, Gabby's new book, In My Kehillah. Kehillah, by the way, is Hebrew for congregation or community. It's now available for advanced purchase, and I just ordered my copies this morning, and I can't wait to share it with our grandchildren and our synagogue, preschool, and religious school. In My Kehillah, it's a great way to follow up for JDAME, and you can go to
I just put it in the chat.
Perfect, jkidaccess.org. And after you pre-order the book, you'll have access to a lot of pre-sale bonuses. Proceeds from the book sales benefit the wonderful work of Jewish Learning Venture. And Gabby, mazal tov. Congratulations.
Thank you for your incredible support. And as you said, to our presenters for sharing all of your wisdom today.
Thank you all.
Thank you very much, everybody.
It's been a pleasure. And